Hello and welcome back to the Age Tech Connect podcast. I'm your host, Daniel Cottmeyer, and today I'm having a conversation with Nat Findlay. Nat is the CEO of Lifeguard Health. Lifeguard Health provides a passive in-home remote monitoring solution to capture critical behavior insights without cameras, microphones, or wearables. When Lifeguard allows care teams to see clearly, overall care improves, older adults live more independently, and caregivers make better decisions with less stress. Nat and the folks from Lifeguard Health will be at the upcoming Home Care and Home Health Workshop at the USC Leonard Davis School of Gerontology on April 24th of this year. So if you're interested in our conversation today, be sure to attend that workshop to connect with Nat and Lifeguard Health. All right, enough with the intro. Nat, it's great to have you with us today.
Thanks, Daniel. Thanks. Really appreciate you taking the time to chat with me. Thank you.
Yeah, so off camera, you got to know a little bit about me, but I always like to start by asking you, what got you into the business of improving the lives of older adults?
That's a long answer, but the quick answer is you would call a serial entrepreneur. This is my eighth or ninth business
Impressive.
in healthcare, some in fitness equipment. You might remember Peloton and
I've heard of it.
yeah. So, developed a lot of the technologies in the late 90s that led to what has now become Peloton. And interestingly, Daniel, that led to a conversation with a physician in Dallas in year 2000. I know I'm dating myself, who was on one of our treadmills that had the large screen and you could do your email and watch movies, etc., while you're on your treadmill. But he emailed us and said, I've got an idea for you. So I flew in to see this physician, and he had an issue with nurses and medication errors. So Nurse Jones goes into your room. She thinks it's me. She gives you my medications. And so we built a very comprehensive drug interaction, medication reconciliation software at bedside with these large screens. So it's not health clubs now, but now we're
Yeah.
hospital beds. That company was acquired by Cardinal Health, and I stayed at Cardinal for 6 years deploying these systems. But in 2008, my wife and I said, we've pretty much done the Fortune 500 thing. Let's do something else. We'll get back into entrepreneur world. So we started developing electronic medical records, direct primary care practices, and that continued profitably until 2015 when we launched into a new venture called Wellbox. And this is, I'll get quickly to the story of Wellbox, but the idea of Wellbox was in 2015, Medicare decided to compensate physicians for the time they would spend with their Medicare patients virtually. So no longer did the doctor have to be paid to have a physical contact with the patient. He could do it over the phone or video. And truly, this was a watershed moment for virtual health or telehealth, telemedicine. And so we quickly put up an organization, petitioned Medicare to say, hey, doctors don't have time to do that. We can do it for them. And so if you think, typical doctor has 1,000 Medicare patients, he doesn't have 20,000 minutes a month to. So we were like a service extension. And that grew well, built that to about at the peak 30,000 Medicare patients, 300 nurses monitoring these patients. But as you can imagine, a system where the well box was, I don't have a box here, but imagine this was a box, but inside the box was your blood pressure cuff, your glucometer, your stress meter, a scale, etc. And our nurses were looking at this dashboard. And basically, if this was your dashboard, we could see exactly how you were trending. And then we'd have conversations with you, and we'd put that note into the doctor's electronic medical record. What we quickly learned, though, was that seniors don't want to be monitored. And so I'm kind of switching the game on you here, Daniel, where in the intro, we talk about monitoring. I call it oversight, And recently I was listening to a podcast on Freakonomics that talked about the reverse mortgage. And the professor that was discussing the reverse mortgage said, is there a worse name in the world? Like, seniors could benefit dramatically from the cash influx that they might get from the equity they have in their homes, but they don't want a reverse mortgage. We have to find a new name for this. And so I'm bringing this up because part of my conference with Jeff at the Innovation Summit in Los Angeles will be around what we've determined now is the implementation friction. But anyway, I digress for a second. So after building Wellbox and selling Wellbox, most of my team decided, well, we would like to start to monitor these seniors, oversee,
Yeah.
oversight
There we
these
go.
seniors in a non-invasive way. How could we do that? And so we looked at motion sensors, we looked at radar devices, anything that wasn't a camera or wasn't a microphone was fair game.
Hmm.
And fortunately, we found a Canadian company called Cognitive that was a world leader in motion detection using Wi-Fi. And
Interesting.
these were a bunch of PhDs that had exited from BlackBerry. You might remember BlackBerry. I think
I'm
some of us
I'm
remember
familiar
BlackBerry.
with that one as well.
Yeah, yeah. And very, very smart people put a lot of effort and capital behind this and had deployed a home security Wi-Fi sensing system
Hmm.
in about 20 million homes through Comcast and Verizon and other companies like that. So their initial project was if somebody's walked into your home and has disrupted the Wi-Fi network, hey, there's an intruder in your home, and you get an update on your iPhone. We said to them, that's cool, but can you tell me if my mother got up this morning? Can you tell me my mother went to bed tonight? Is she in the bathroom too long? Did she take a shower? All these things that a home care agency and we as lifeguards would be interested in. Can you tell us about that through Wi-Fi? And well, it's interesting. Yes, we can. And so for the last year and a half, we've worked closely with the team at Cognitive. They've been just fantastic partners. And we have a platform now. Think of it as an electronic medical record, but we're not receiving biometric data. We're receiving data around the activities of daily living. And the most important one that we're monitoring in what we call now our Lifeguard Alert Center is what we call a critical inactivity. So everybody knows that you could wear a bracelet, an iWatch, or a pendant, and you could have sort of a fall detection. And
Yeah.
market has been very educated by Lifeline and other companies, what we call the PERS industry, the personal emergency response
Mm.
industry, to educate about quick response to a fall. Okay, it works, but it only works if the senior is wearing the pendant or wearing the bracelet, right? So
And that can be tougher than you think.
yeah, absolutely.
Yeah.
Did they charge it up or did they lose it or they just place it in a drawer? But incredibly, Daniel, there's 6 million Americans that subscribe to that service every year. Like it's a
Mhm.
big industry.
Yeah.
So in our product, though, we say in critical inactivity, we know Mrs. Jones is home because we've seen activity in the home. And we know she hasn't left the front door or the back door. So she's there. But wow, she's not active when she should have been active.
Hmm.
So something's up. So we phone Mrs. Jones. If she doesn't answer, we phone you or your son or daughter. You get the idea, the circle of care. And
Yeah.
eventually it would lead to an emergency response system. Through the Wi-Fi also, we're able to determine other wellness trends. And these insights allow care agencies to have real data now. So if you're
Yeah.
a case manager at, let's say, Right at Home, Griswold, the Key, one of the bigger organizations, or even a smaller independent organization, you now have data when you're sitting with the family. You can say, well, your mother is getting up at 5:30 in the morning. She's having issues perhaps with hygiene. We suggest that the caregiver come earlier.
Yeah.
And so this leads to more hours of care or more proactive care. And so that's kind of what we're up to, Danielle. I know I've babbled here for the last
Yeah.
minutes, but that's how I got here and what our mission is.
Definitely give me a lot to work on there. I want to start back and kind of paint the broader picture because you brought up a lot of times, the healthcare team has real data, right? And we could see whether mom is getting up in the middle of the night. We could see whether mom is moving in the kitchen, moving in the bathroom. But somebody who's not used to this space might say, why do I care if my mom's moving in the bathroom? Why do I care if my mom's moving in the kitchen? Right? So could you paint a picture for how a lot of people progress from this life of, being independent in the home and then progress to needing higher levels of care? And what are those data points that we can see through those things that you talked about,
Oh,
like moving in the
sure.
home, moving in the kitchen?
Yeah.
Why do those things matter?
Well, super question. Let's sort of break them down. Mrs. Jones went to the bathroom
Hmm.
excessively over the last 2 days. She definitely has a UTI.
Yeah.
Boom.
Hmm.
And instead of getting her out to the hospital, we can now intervene. The home care agency can get her the care or the meds that she needs to get that fixed. And it's, UTIs develop into have serious consequences down the road. Mrs. Jones been in the bathroom frequently the last 2 days. She's got a gastro. She's got a bug. There's food intolerance. There's a food poisoning. There's a virus. There's another issue that needs to be looked at. So that's sort of on that side. The system also has a humidity sensor. Mrs. Jones tells her family that she bathes every day. we know that Mrs. Jones hasn't had a shower in the last 3 days or 4 days.
Just
But
from the humidity sensor?
sure.
Very cool.
And oh, by the way, that's in her care plan. So somebody from the care agency maybe is not giving Mrs. Jones the bath that she, or the hygiene or the care she needs. And so that's, not putting it on the back of the care agency, but there are service delivery issues.
Hmm.
Sometimes, it's just simply somebody's forgotten, or the senior is pushed back. No, I don't want to have my bath today. So there's
Yeah.
issues around hygiene. Absolutely. We noticed that Mrs. Jones hasn't opened the fridge door in the last 3 days. Oh, then why not? Is she just ordering in Chipotle, or does she have a subscription to DoorDash? I'm being frivolous with you, Daniel, but
Yeah.
you get the idea. She's not
Mhm.
eating. We noticed that Mrs. Jones is now sleeping on the sofa. Why isn't Mrs. Jones in her bed? And why is she sleeping on the sofa? And so these things need to be investigated. We noticed that Mrs. Jones just spent the last 5 hours in the living room watching television. She's been on the sofa for 5 hours.
Mhm.
Now she's moving, but that's not healthy. So she should be up and be kept more active. So there also is desired by the home agencies to have a better understanding of what the home care assistants are doing, and particularly on the night shifts. Did the caregiver come in at 11 o'clock and even visit the bedroom?
Mm.
Did they visit the bedroom at the frequency that's required for somebody who's supposed to be staying awake and visiting or looking after the senior? Or did they just watch television, or did they sleep on the sofa? There's a whole myriad, Daniel, of things that can be interpreted from that are important and valuable to keep these seniors home.
Because I think what a lot of people don't realize is it really is the small changes in behavior that get out of control that lead to those big events that most people think about, like falls in the home or having a disease that, runs rampant and it ends up in a hospitalization or even serious
Yeah,
injury or
sure.
death. And people think, oh, well, if something's going wrong, my family member will tell me. Or if something's going wrong, I'll know. But people don't appreciate how often it is that family members would be like, man, I haven't heard from mom in 5 days. What's going on? So what you're saying is you have a completely passive way of getting that insight early on
Yeah.
without anybody needing to give any conscious attention to it.
Danielle, you got to come and work with us. That's an awesome explanation. So there's no cameras, there's no microphones, so it's completely private. But back to the falls, you're right. It's interesting. I was reading a piece the other day in the Medicare Advantage News Journal. 12 of the largest Medicare Advantage plans identified falls as the number one cost driver of a Medicare Advantage plan. So that's
It's a huge issue.
that, yeah, I mean, obviously a hip operation's
Mhm.
$85,000 now. That if they end up paying that, obviously they don't, but you get the idea. It's a massive thing. And on the home care agency side, as Michael, the CEO of Griswold, has mentioned recently in another podcast that I was listening to, or webinar that he put on, he estimates that 8% of his revenue monthly churns out because of a fall. These are people that are on service, but they had a fall. Now they're in the hospital and they're no longer a client of Griswold. So every point that he could save on that is obviously beneficial to that organization.
Yeah, so getting tabs on this stuff early on, really what you're saying is it's beneficial to the patient because they get better health. It's beneficial to the family because they get less stress. And then it's cheaper for the payers and better for the home care providers because they can do their jobs better. Now, if you were a savvy family member, a savvy caregiver, a savvy operator of a senior living facility, and you knew how big of an issue it was to make sure that we can have insight into how an older adult is moving inside of their home, before we had solutions like what you guys are providing at Lifeguard, what were really your options for monitoring?
I mean, when you think of senior living, which is not our current market, but I've certainly visited a number of, continuous care retirement communities, senior living facilities. I mean, there's a button and sometimes it doesn't work, or there's the cord that's
Yeah,
going to
yeah.
pull out the cord. But of course, if
Mhm.
you've fallen in the bathroom, you can't actually get out to get the cord. It's a rapidly invested in market, Danielle. I think as Jeff and I chatted the other day, he could name 6 companies that have raised over $350 million in the last 12 months
Mm.
in the senior living area. So these are smart cameras, other types of motion detection technologies, et cetera. So clearly that side of the world, they understand that, falls and people at risk is it's a business issue they need to deal with through
Yeah.
quote unquote monitoring. For the time being, we're focused very, very much on the home care, non-medical home care as opposed to home health industry.
And why is it so important in the home? I've heard a lot about the term aging in place. I'm sure a lot of our listeners have heard of that. Is that kind of what you guys are going for in helping adults age in place safer and longer?
That is totally where we're at. I think we're coming at it from a bit of a different angle in that we've realized that through our Wellbox experience that the wearables, the bracelets, the pendants are not an adequate solution. And so we're providing a new way of looking at that. Now, will it always be Wi-Fi? I hope so. Wi-Fi is becoming more and more of a standard. There are new standards coming out. There are 5G chips coming out. It's just going to become much more precise. That's where we're at. So think of us as like a vertical SaaS, software as a
Yeah.
service business, but dedicated to the home care industry. There's lots of runway there. I mean, there's 30,000 agencies. There's 15 million Americans are receiving private home care today as we speak. So
Yeah, certainly plenty of space to operate in there. You talked about this oversight versus monitoring, and it really seems like you guys are leaning into that passive solution, right? That low effort in a good way solution. Can you describe to me how a solution like yours, one that's completely passive, can change this term of monitoring, which seems really invasive, kind of big brothery, and
yeah,
change it to that oversight, which instead of limiting independence, instead of putting you in a box, actually can expand independence for an older adult and for caregivers?
I hate to be the interviewee that says, that's a great question, but you asked some great questions. I think we are all, anybody that's in this industry is struggling with that. That is what my friend Mike at Griswold calls the implementation friction.
Yeah, lean
How,
into that a bit more. I'm curious as to what that is.
how to describe that? The case manager working at one of these large agencies has been providing home care and oversight for the last, call it 15, 10, 15, she's a veteran.
Hmm.
She's never had technology. She's never needed technology. And now in this model where we work with care agencies, she's now put on point as the person who's going to explain this to the family and explain it to the senior. But she's not a tech person. She's a care person. She's a nurse. So to get around that, I don't call it a roadblock. It's just
Hmm.
part of the industry. I think we need to look at these types of solutions more as affinity programs, Fidelity programs, like your frequent flyer miles, that you get from
Hmm.
United Airlines or American Airlines. And so what we're proposing moving forward is that when you would sign an agreement with one of the agencies that we work with, you'll get a nice letter. You will, because you're paying
Hmm.
for the service for your mother or your dad. And the letter will say, Daniel, we have this amazing service that keeps eyes and ears on your loved one while we're not in the home. Here's the insights it provides. It provides critical inactivity alerts. It's 24-hour, quote unquote monitoring. I've got to come up with a better word for that. It's
Yeah.
about oversight. And it's included because you're now a customer of agency XYZ. And we will come and install it for you professionally, or it will take you 10 minutes. Just let us know how you'd like to proceed. I mean, nobody gets a gift for buying home care,
Yeah.
right? It's like, no, it's just a big expense, but now you're getting this gift.
Yeah.
And so I've been working on different ways of the nomenclature of this, like it's our agency's pinnacle program. You're a pinnacle client, so you now have this benefit. And now all of a sudden the technology is a benefit that you're receiving at no charge, as opposed to a cost or some other thing you've got a hassle with. And you go, wow, I really like this agency. This is good.
Hmm.
You know, every 2 weeks you're getting a report from Lifeguard that gives you the insights on what's going on in your mother's home. Your mother may have received a call at 10 o'clock one morning on a Sunday morning because the Lifeguard Alert Center says, well, normally you get up at 9 o'clock. Now, are you okay this morning? And then your mother's really happy because she now has this understanding that it's not just some invisible person, quote unquote, monitoring. She actually has a guardian. She actually has some other safety net, if you will, in her home. Now, I've started to engage some really smart thinkers, Dan, over the next, currently messaging, marketing, positioning,
Hmm.
savants, and
Yeah.
we will tackle this part of, what is the best practice about how to position this. But certainly the gift box, the gift service, the affinity program, I'm really convinced that's going to be a big part of our success moving forward.
Have you gotten a lot of resistance when talking with older adults and family members? Like, where does that pushback usually come from, or do people kind of get it pretty quick?
There's a mix there, Daniel. I mean, there are seniors that no, they don't want any tech, and that's part of it, but that's a real small minority.
Yeah.
Real small minority. And of the family members, if it's explained adequately, then
Hmm.
they're all in as well. Like it's additional peace of mind. Who wouldn't want this for their mother or their father or grandparent for sure?
What other examples of kind of like that aha moment do you see when you're implementing lifeguards? So you spoke about the mother who gets the call and says, "Hey, you usually wake up at 9 a.m. What happened?" That could kind of like a light bulb moment for her going, "Hey,
Yeah, it
this
was.
this is something." Do you guys get a lot of those? Like a lot of people saying, like, I didn't really get it until this happened.
Well, even for me, until I heard that story, it just jolted me. I said, wow, that's what we've built.
Hmm.
And it made me think back to our Wellbox days. I would listen, there were thousands of calls each week, of course, and you can only listen to a small sample and they're anonymized. So I don't know who I'm actually listening to, but
Yeah.
or they're recorded. But I remember this one lady, it was Nurse Jones, and she answered, "Oh, hi, Betty. I'm calling from Wellbox and blah blah blah." And then Betty says, "Nurse Jones, I love you. You call me every month, and I really enjoy my conversations with you. But I'm 78 years old. I've got diabetes. I'm always going to have diabetes. But I've got all these other issues around nutrition and my house and things going on with my sons and daughters. Could you help me with those?"
Hmm.
And our nurse would say, "I'm sorry. I'm paid by Medicare to just look after your diabetes. That's all I can do for you today." And so, any way that the lifeguard team can be helping these seniors with these other issues, regardless of whether they didn't get up on time this morning, I think that's where I can see our company going. We've got the oversight, and there might have been a critical inactivity, and maybe your bathroom hygiene score is going down, and we can get that fixed or whatever. But there, this is a whole world of other things that these seniors want to talk about and need to talk about to keep them safe and aging at home. And I think that's the broader mission of Lifeguard. Now, we're not there yet.
Yeah.
We're just getting off the ground, really, in terms of commercial deployment. But we've got the technology built, we've got the back end built, and now, training our agents to be alert and attentive to other issues. I'm really eager to get started on that.
Yeah. And I love that sentiment because I feel like a lot of times in age tech space, we can kind of, even though it's such a human thing, we can kind of lose the humanity of it, right? If you take away those words, you can look at the aging individual as a statistic, and obviously the technology is very inhuman. And then you kind of start to think about it. A lot of people who work in the age tech space haven't actually talked to an older adult, somebody in their 70s, 80s, 90s, really anytime recently. And I think a lot of these older adults, they just want to maintain their feeling of personhood, right? They want to say, I'm still independent. I'm still out there. I want to chat. I
Sure.
have family. I have dreams. I have goals, right? And sometimes we like to kind of take that out of the equation. And so I'm interested in, you say it's kind of your future to expand that humanity with Lifeguard Health's technology. How would a solution like Lifeguard Health enable an older person to live with greater humanity and to live with greater vigor?
Yeah. Again, wonderful. Yeah, reflect on that one. Chewy?
Like the
Yeah,
dog brand?
the pet
Yeah.
brand.
Yeah, the pet
Yeah,
brand. I'm familiar, yeah.
yeah,
I'm
and
curious as to where this goes.
well, one of the companies I admire, and you look at their customer service satisfaction scores, and customer retention is just completely off the chart. And I was talking to an executive at Chick-fil-A a couple of years ago, and he came up with this expression. We talked about the customer experience at Chick-fil-A, and he said, "We just chewied them to death."
Hmm.
Wow, we just chewied them to death. And so that's what I'm hoping we'll do with our lifeguard seniors. We're just going to chewy them to death. And there's a lot of solutions coming out now with AI, voice
Hmm.
agents in the senior space. And I want to be the flip side of that. I don't want my seniors talking to an AI bot and having a conversation with a virtual assistant. No, I want them to talk with somebody who has real empathy for what they're going through, and how can we coach them on their issue. And are you watching the Apple TV series called Shrinking?
No, I think I watched like one episode of it, but I
Yeah,
haven't
it's really
haven't
good.
kept
It's
up
really
with it.
good.
Yeah.
Yeah. So highly recommended. I'm a big
Mm.
Shrinking fan, but it's a nice little story of 4 or 5 different individuals who are going through different phases of their life, and they've got different
Yeah.
issues. And of course, Harrison Ford is the lead guy, not necessarily, I wouldn't call him the protagonist, but he's the head
Mhm.
therapist.
Yeah.
And they're just sweet stories, they're just sweet situations that, as a friend said to me when a few years ago, I was complaining about something. He said, Nat, we all have
Mm.
issues. So how can I help these lonely seniors with their issues? I'm not quite sure yet, Danielle, but the first
Mhm.
one, I'm going to keep them safe physically. If they have fallen, or if they're in stress, we're going to be there to help them. But for the non-stressful stuff, we're certainly going to, the next category of stress down, we're going to figure out how to help them as well. I guess you would think of us as not necessarily care navigators. There's a whole world
Yeah.
of care navigators out there now that can help you work your way through the healthcare system and the medical system. But what if our care managers can help these seniors navigate their life
Hmm.
just through a conversation?
So
So
it's almost a shift from, are you monitoring these people, or are you making them feel seen, right? Are you a monitoring solution, or are you
bingo.
a way to make older
Wow.
adults feel like you understand them, their
Yeah,
problems they're going through, and you're there to help?
bingo. Yeah.
Yeah.
You got an issue, call us, or we're going to call you if we think you got an issue. But either way, we're your lifeguards.
Because that's also a big struggle for older adults is like, they kind of feel like they're getting pushed to the wayside, right? They kind of feel like nobody understands them anymore, right? They're kind of getting aged out of the system, right?
Yeah.
So
Yeah.
I had never thought about how something like, a Wi-Fi home oversight system could really make an older adult feel seen and make them feel included and maximize their humanity like that.
Yeah. Well, look, Daniel, this is where I want to take the company. Today, we've got the technology built. We've got a
Hmm.
great lifeguard alert center, but this is definitely the path we're going to go down. And I was thinking the other day, I was listening to this other podcast driving. I was up in Orlando on business this week for a day and a half, and it was a New York Times podcast on the whole offshore fraud industry.
Hmm.
Seniors being targeted, how
Yeah.
they're targeted. Oh, wow. What if our lifeguard clients phoned up and said, "Hey, I just got this email from Nigeria. Do you think it's a
Mm.
scam?" And then, yeah, for sure it's a scam. And there's billions and billions of dollars that these seniors are being frauded out of. So again, they didn't fall, but they're in danger of losing their money. So, we could be there to help them as well.
Yeah, these scams are getting pretty good. When I find myself almost getting tricked by a few of these, like there's been a few good ones that have come across my phone that I'm like, man, I can't imagine how older adults are feeling or having a
Yeah.
hard time navigating with
Oh,
these.
for sure. Yeah. Well, the latest one apparently is that they do call masking, and you look at the call, it's, Chase Bank, or, USA Bank or whatever. And Mr. Cottmeyer, just calling to confirm your password. And,
Hmm.
you think it's the bank, right? And, they know your date of birth. They know, your
Yeah.
mother's maiden name, but now they want to confirm your password, and bingo, guess what? You're toast. Yeah.
So we talked a little bit about this, all the problems that could, come up in the future and how this kind of oversight program could be developed. Where do you really think that this is going? So in terms of, we have a lot of innovators, future innovators, current innovators who would who would watch this podcast. Where do you think we need to navigate, dude, to make that vision you're talking about a reality? What are the pitfalls we need to avoid, and what are the core principles that we need to chase moving forward and creating technology in this space?
Well, I guess it depends on the problem you're trying to solve. When I worked at Cardinal in these drug medication error systems, we had a chap come in from the National Health Service, and he was a guru in all things quality control. And he literally came into the conference with pieces of Swiss cheese.
Hmm.
Okay. So every slice of Swiss cheese has a hole in it.
Yeah.
But if you line up the holes, things can go through, right?
Okay. Yeah.
So, and as he explained, airlines don't fall out of the sky because of one thing. It's
Hmm.
a sequence of errors that were made that led to, a catastrophe. And so I think that's one of the things I would consider if I was coaching somebody around this. Like, what's the real problem we're trying to get to here? We're suffering a bit. I think anybody in this, what we now call current home monitoring world, is suffering a bit from, alert fatigue. There are a lot of false positives in a lot of systems, including ours, where we know what those gaps are. We're closing them up. But at some point, the senior or their family says, hold on a second, I'm actually here and you think I'm not here. So why are you phoning me again? You got to make sure your thing's pretty tight and buttoned up before you get it in the marketplace. I don't know. I'm a little leery about devices in the home. There are solutions that are lights that have radars in them, things that need wires to run up walls. I think those are non-starters. I know they're non-starters. Just for now, if they can become battery powered, that's a whole other story.
Yeah.
I'm looking at a lot of stuff in France around AI vision, and the privacy around that, I think, is going to improve. But these AI systems that use NVIDIA chips, they'll freak you out, Daniel. I mean, they're so powerful. Like,
yeah.
I mean, if Mrs. Jones is knitting, they know she's knitting. If she's eating a piece of pizza, it pretty much knows exactly what she's doing.
Yeah.
Now, where it works right now is the processing of all of that happens on the chip and then it's sent up to the cloud, but you still have to explain to the senior that it's a camera, right? So
yeah.
which
And that's when you get into that balance between fidelity of data and feeling very big brotherish, right?
Yeah. So for today, I mean, I hate to tout our own horn, but Wi-Fi sensing has a lot of things going for it in today's world.
Because it is beautifully simple. So that kind of brings us into the next thing of like, where do you think we need to lean more into? Obviously, you guys are leaning into the simplicity, the passivity of the solution, using that high level metric of where the older adult is moving throughout the house to get really robust insights. Where do you think we need to keep leaning into to make the progress that you've talked about in this space?
Yeah, I just go back to Chewy. I really just think it's Chewy. It's this Mrs. Jones who's on the lifeguard system feel secure. Does she feel cared for? And yes, the caregiver's coming. And yes, she's got her family members. But are we filling an extra void in that whole sort of care world that she finds and her family finds unique and experience? I'm grasping for the word that describes it, but it gives her this serenity. There's this idea of integral, the completeness. It's not just one piece, it's the whole ensemble of the experience.
Yeah.
It's all kind of brewing in my mind right now. I know I've got the foundation built, Dan, but this is the next part of my journey. Yeah.
Very cool. It sounds like there's some really big things coming out of Lifeguard Health. A lot of French words. Do you have a French background?
I have a French wife.
Oh, okay. That helps out. Yeah.
Yeah.
I was gonna say this guy's speaking with some eloquence here.
No, thanks. Yeah.
We don't have that in English, but I know we're pushing right up against our time limit today. So I think that's a good place to end it off. I really appreciate you coming in today.
Daniel, thanks for having me. And please say hi to Jeff. And I hope to see you in Los Angeles at the next event that's coming up.
Yeah, for sure. So for anyone watching on that note who is interested in getting connected with you or learning more about Lifeguard Health, how can they do that? I know you'll be at the home care and home health workshop hosted in LA, but where else can folks get in contact with you?
Really easily on our website, joinlifeguard.com. And my email is nfindlay, Findlay, at joinlifeguard.com. And happy to meet anybody, talk about these. And hopefully this has stimulated or will stimulate a conversation around, the bigger picture of home monitoring. Where does that road take us?
And I think we got to do this again in a year or so once we sort out some of those more ethereal ideas and see where those actually came from. I can tell there's a lot brewing in there, and I'm excited to see where this goes in the next year or so.
Thanks, Dan. You're the best.
You too. It was great to chat with you.
Thanks, man. Be well. Thanks again.